Hello everyone, my name is Dr. Poornima Ramakrishna and I'm working at Apollo Cradle Hospitals at Bangalore in the Koramangala branch. So I'm very happy and delighted to have this small session with you where I'll be discussing a couple of topics which is getting a little more commonly seen today. What are they? The first one is something what we call as cervical insufficiency. Now what is this? To explain to you in a simple terminology, a cervix is nothing but the mouth of the womb. So the uterus or the womb, its mouth is called as a cervix. Insufficiency means that something in it makes it weak, because of which it cannot carry the pregnancy completely to full term, thereby sometimes resulting in a miscarriage, unfortunately, and sometimes also resulting in early delivery before your 9th month, where sometimes the baby needs to go into the ICU and needs further care over there, which can result in lot of emotional and medical expenditures too. So we would like to identify those set of patients as early as possible in their 3rd or 4th month with the help of scans, where we see the cervix, that is the uterus womb's mouth, where we say if there is any kind of insufficiency or we feel that it is getting short, which is considered as less than 2.5 centimeters. And then we suggest the couple to go in for a couple of options, which includes putting a stitch, what we call as a cervical stitch, at the right time in order to prevent both a miscarriage and an early or a premature delivery. And alternatively, we also tell them to look at having certain injections, which are hormonal injections called progesterone, which is of course carried on up to the full term. So this is a very, as I said, it is something seen more often today. And as doctors, we even wonder, why is it getting more often? Why are we seeing these conditions more today? We really don't know the exact cause, but a lot of it is dependent on lifestyle sometimes. And more so we see high-risk pregnancies where the woman is carrying twins, or she is carrying higher multiple of gestations, or she may have undergone certain procedures for fertility, which is extremely common today. So I would like to give you the final touch on cervical insufficiency is that the importance of scans, which you do it in your 3rd month and 5th month, picking up the condition early and thereby preventing it by either putting a stitch and giving you a hormonal injection, carrying your pregnancy to term and having a safe and a healthy baby. So this is one of the topics which I briefly wanted to discuss with you. Now the other one being something what we call as an ovarian insufficiency. So what are ovaries? Ovaries are bags or pouches which contains eggs. Where are they present? They are present in the pelvis on either side of the womb, that's the uterus. So all women have 2 ovaries and they are born with eggs which is included into these pouches or the egg bags as early as when they were babies in their mother's womb. So meaning to say, when you are born, there is a reservoir and this reservoir only depletes. It does not add. Meaning as a woman gets older and older, the eggs become lesser and lesser. So looking at today's generation, looking at today's women who is career oriented and multitasking, looking at the ages drifting away more towards the older generation, looking at marriages, late onset marriages, late decisions on pregnancies, we are seeing that the depletion of the eggs in the ovaries are getting tremendous. Also in addition, certain lifestyle changes in the same woman, which also leads to sudden early depletion as young as 30 years too. So those changes which were supposed to happen to you when you are 40 is happening at 30. Those changes which were supposed to happen at 45 is happening at 35. So as I said, there are multifactorial causes for this. One of them could be lifestyle. Some of them could also be genetic, environmental, and rarely an infection. Why are we concerned about this? We are concerned because of the growing population of elderly couples or even not so elderly couples not able to have a baby because there are no eggs, or it is so less, though she is pretty as young as 30 or 32, the eggs are less. So this is something what we call as ovarian insufficiency. How do we help these couples? So once we identify that this is the cause of not being able to have a baby, we talk to them sensitively about the need for probable IVF pregnancies where she may require an egg donor, because this becomes an extremely emotional, challenging situation for the couple where they may have to look at an egg donation, meaning not their own biological child, or sometimes egg retrieval methods through certain injections and freezing the egg for future use. Well, all this is possible today in science. So those women also can look at those who are so much into their career or looking at late marriages can even approach gynecologists a little early in order to freeze the eggs, and egg freezing is a very viable option today in the modern era of gynecology. So thereby, though she gets older, her eggs which she has frozen a few years back maintains their age at that point of time. So the quality and the quantity of eggs is preserved, and whenever she wants to have a baby, she can retrieve those eggs and look at a healthy pregnancy through IVF and other options. Well, those of couples who are not able to do this, we do look at egg donor programs, and we do look at IVF or even surrogacy in certain cases. So what I want to say in this particular situation to all couples is to look at their own decisions in life, which should be taken at the right time. The choices are definitely available, and discussing with your doctor, discussing with your gynecologist definitely makes a very good beginning if you're looking at your career in motherhood. Wishing you all the best. Thank you for giving me this opportunity to share these few things. Thank you very much.